Mr. Speaker, I apologize, but I rise to, I move a motion with a notice for Parliament to accept speech and ministerial statement that I will make, please.
Motion is that the motion be agreed to. Those in favor say aye.
Aye.
Against, say no. Prime Minister.
Mr. Speaker, I firstly would like to thank you for allowing my motion to be heard and passed. I thank all our members of Parliament, ministers, governors, and members on both sides of the House for sitting up late and waking up late. Although with COVID-19 peaking here, and we're sitting and waking, exposing our own lives to the risk of COVID-19, I'd like to make some statement in regards to COVID-19, statement on how we should go forward from here today in this Parliament and onwards. And I ask members of our Parliament to give me the next 5 or 10 minutes for some statements to be made, and I make this statement especially in regards to what we face today as a country, in as far as COVID and COVID influence and COVID effect on our economy and our country. And hopefully when my speech is done, I would like to rally each and every one of us to the task that lays ahead of us, at our own districts, at our own provinces, and in our ministries. Together we can rise to work for our country better, instead of just sitting in and playing politics, listening to each other criticize. Of course, there are places for criticism and healthy criticism, but personalized criticism and politics at the expense of development must sometimes come to a stop. Today we are in no ordinary times. 3 years ago, 4 years ago, in fact, over 2 years ago, without COVID-19, the world was far different place than where it is today. With COVID-19, you can have all your associate focus on the economy and what we want to do for our country, but COVID-19 and its effect is emerging and continues to evolve, just like the mutation that takes place in the COVID strands. And this short statement of us in respect to a very important call by the member for Abao earlier today, that there must be a statement made. I'd like to, through this statement, give assurance to the leader that the health minister will present a very detailed statement to the country in the not too distant future on what we have done thus far and what we will do going into the future, because COVID-19 is not just a once-off event. The effect of COVID-19, Mr. Speaker, will be felt for the next decade and possibly into the future. If I'm not wrong, COVID-19 is possibly here to stay. COVID, for those who are medical doctors will confirm to us, is a cousin of what was MERS and SARS before. Today's COVID-19 mutation is taking place, and so the world will have to adapt to live with COVID-19. The world is adapting to living with COVID-19. And the treasurer's words on the economy rebounding in 2021 is observed. I observed, and I also read from IMF and World Bank report that the economy will pitch a little bit better than what it was last year, especially the engines of the economy that runs USA and China is now rebounding and reconfiguring. And so not all is bad, but we all have to rally in these hard times. There are roles for each and every one of us to play, Mr. Speaker. And I will conclude on this role, hopefully, and we all can find attraction. Whilst we have our own mandates to throw slingshots and mud at each other, also, importantly, we must all rise in our respective areas of leadership responsibilities. Since our first index case in March 23 last year, our COVID cases today has gone past 10,000 as I speak. Of this 10,000, 47% are symptomatic cases and 53% are asymptomatic cases. So it's almost an even split, meaning those who are exposed can be fatal for our country. Needless to remind us, we've had our colleague, the Honorable late Richard Madani, who passed on. We've had a member of our parliamentary staff who passed on. Today the Speaker was giving us statistics earlier today, and many of us possibly did not hear clearly the statistics that he was pointing to us this morning. Of 167 tested, 42 samples have returned positive from those who work in Parliament. Speaker's own staff in those close staff of his, 4 or 5 in his office have come down with positive COVID cases. And so with 25% of Parliament staff returned positive results in as far as COVID testing is concerned, and more tests will be done. Our controller is doing his absolute best. He's now labeled those who work in Parliament as essential staff, and let me commend the Health Minister who's worked overtime. Today, as we speak, 100,000 vaccines have come in. These 100,000 are available for us to, first and foremost, transfer to other country for those who are identified as essential Papua New Guineans who will hold our economy together. And secondly, those who are asymptomatic and those who belong to age bracket above 60 and beyond, so that we protect our elderly and protect those who are essential staff, including first and foremost those who work in our front lines, like health workers, police and defense, who are assisting in the rollout of policing of the COVID-19. So, Mr. Speaker, COVID-19 situation that faces us is nothing for us to be politicking about. It's nothing for us to use as a point-scoring opportunity. COVID has hit us. COVID is here despite our best endeavors to shut down. And I remember very clearly, last year when our index case was established, we went for a hard lockdown and overdrive shutdown. The Yale on the other side of the spectrum demanding reopening of our the lockdown because of the need for economy to be alive grew big. And we tried readapting, but needless to remind all of us, we know the statistics that we are faced with. Statistics of our health system, statistics of how our people respond to such situations or order or command from our control center. Despite best direction from our National Control Center, we still face with this situation where over 10,000 people now as we speak in Papua New Guinea COVID or have been exposed to COVID. All of us here have been exposed to COVID too. And some of us have been COVID positive. And I thank those who have come out to explain what COVID is and it was to them in as far as them lying in sickbed. So today, let me say, with COVID threat facing us, our government last year, we have not been sleeping too, and something that we at the National Control Center have been sitting back and misusing money. Let me inform and report to all of us. Since last year, we've funneled through our PHAs a total envelope of 149.6 million kina. Of that envelope, about 12 million kina still remains sitting in our HSSP trust account. Most provinces on average, and this is little amount, but most provincial health authorities on average have received 2.2 million kina as added money under the banner of COVID and for them to respond to the pandemics. Today as I speak, only East New Britain, Western Highlands, West New Britain, NCD and Port Moresby General Hospitals have provided acquittals for the small fund that we've given to them. This fund is on top of the money that we directly transferred to our districts and provinces. In our districts and provinces, WAS facilities, 500,000 each. For economic interventions, when the member for Yalu Pangia talks about what have we done in times of economic contractions, well, part of those in terms of economic stimulus, the total envelope, 1 million each went for agriculture interventions at the lowest level, where our people are. And as far as districts and provinces, their disbursements, you would have distributed 1 million kina each. That's 111 million kina. Our government's direct intervention in the front line, where our people are, for them to participate in agriculture, for them to participate in SME, another 500,000 kina each were given to 111. So you do your mathematics. That's over 200 million kina would have been transacted from Wagani public accounts to the front line, using district conduits and using provincial conduits to ensure that our people at least see some liquidity through the districts and through the province in as far as getting them helped in COVID-induced tough times. Now, from the national government disbursements, we hope and anticipated that the provincial PHAs would step up. And the provincial PHAs would have stepped up in these specific areas, in as far as 9 key areas that the health department and our COVID-19 emergency response wanted. Clinical management and healthcare, operations, procurement and logistics, laboratory services, risk communication and community engagements, surveillance and rapid response, infection prevention and control, and establishing point of entry supervisions, including establishing non-pharmaceutical public health care and awareness, like working with our national strategy for isolation to work at a district or at the provinces, coordinated by the provincial control center and assisted or working in partnership with the provincial health authority. So as I speak today, and about 2 weeks ago I was at the national control center, I asked the health minister and the controller whether we have clear link to the provincial control centers and whether the provincial control centers are linked or fed or having live relationship with the districts. Mr. Speaker, the sad reality is that because of personality again, just like we have personality issues at the national level, PHA seems to be completely isolated from the provincial government. I have one case where the PHA runs away without informing the government, comes and works with the medical contractor for the vaccination program. As a clear disjoint. Apparently the PHA structure we set up thinks they are autonomous, they are high and mighty, and they can work on their own. And so those teething issues we have identified, and as we rise and adjourn Parliament, I will spend my own time to ensure that this is ironed out and resolved. Today is no time for us to be territorial. And so, governors, I ask you in this honorable house, our people, it's easy to manage when we have our governors stepping up and take leadership in the provinces. I will not be a Prime Minister, Mr. Speaker, of trying to control Papua New Guinea from Waigani. It is something I subscribe to. I believe in devolution of power. Devolution of power, and many of you open members know this, Mr. Speaker, that I've always advocated for provincial government to be the sub-national government agencies on the ground coordinating all our government problems. Mr. Speaker, an appeal to this House, members of Parliament, the Treasurer's job, Finance Minister's job, Planning Minister's job, and my job and the Cabinet's job is to ensure we try our best within the context of what we have in our budget. We will make it available to you at the front line. Today, we really need, Mr. Speaker, these statistics at the infection rate of 1 person infected to pass on to 3 minimum. Not discounting the fact that we live in society. There's a house cry every second day, despite no go to house cry. There's a community program every day, despite the warnings. And so we stand totally exposed than most countries who respect orders and they stay and keep them to themselves. There's an urgent need for each and every one of us to go back to our respective districts and provinces. And for Waigani, we will rise up to try to ensure we remove impediments that block you from trying to assist in your district or assist in province. And for Waigani, we will try to ensure we supply resources to you. Today, your health expenditures must also link to COVID as well as other diseases that we have facing our people. Your education expenditures must link to COVID-based program, because next year onwards, and COVID is here to stay for some time, and respiratory disease will be here for some time, then we now have to relook at classroom sizes. I commend Governor Winty. I fly over every time in his province, I see the green roofs. He's expanding more high schools than any other provinces. I think he's investing a lot of money to the high schools. Well, Mr. Speaker, to you, Governor Winty, your classroom size now we must reconfigure to maybe 20 students in a class. we have overcrowding in our classes. So, Mr. Speaker, what I'm trying to point is, COVID is here to stay. We just have to readjust our work program. Government's resource to districts last year, over 1.5 billion kina transferred from Wagani public accounts, Mr. Treasurer, I may be wrong, straight to your districts and provinces. I beg a question under the auspices, under the title of DSIP and COVID support, and the extra supports that has come. We're still mobilizing that space. Please report back and audit on, report on what you've done, and finance and planning and ORD will check on this. But this is a COVID time. I ask you and I appeal to each and every one of you, as you break in Parliament, spend quality time in the leadership roles that God has placed you in. Whilst there time and moment to be Prime Minister, and someone is bidding again to be Prime Minister. Whilst there are times and moment, Mr. Speaker, to be Minister. Whilst there are time and moment for us to contest for elections. Today is no ordinary time. You cannot be a messiah in this time when the entire world is contracted into cover. It's a bio-warfare that the world is facing. No one, not even the most powerful nation on the face of planet Earth, can stop COVID-19. It has ravaged the economy. They're still recovering. They're trialing vaccines after vaccines. Today is no time for us to play politics. Today is no time for us to be exchanging fights here in Wagani when our people needs us back home in where we come from. I rise today to point to us. COVID-19 has exposed the vulnerabilities we have in our public service system, in our health system, in everything we have as a country. Today, I appeal as we discuss COVID-19, let's step back and see it in the context of care and welfare of our nation and our people. We stand ready as we've supplied you, and I speak on record. I speak on record. Our Treasurer, our Finance and Planning have disbursed unfailingly record money in times of tight economic conditions to the districts and to the province. You can dovetail all your district plan to ensure we are COVID responsive at your districts, or we are COVID responsive at your provinces. We will give you that coverage you need in as far as ensuring that your work program is geared towards getting our people living with COVID, getting our people rebound with COVID, and getting our people ready to face COVID, and God forbid, but if one or two dies, then we bury them in the process, but the rest in the country must not die. Our government will speak on allocations, knowing that we're living in tough times, Mr. Speaker. And I hear clearly a former Prime Minister talking about what have we done for local people. What level of hypocrisy can this statement be when, as government, for 8 years, local contractors were given their back. Local contractors were given their back in favor of overseas-based contractors. What level of hypocrisy is this? Today, we have placed value to local contractors, number one. Today, we put 200 million kina already in banks last year. We'll put another 200 million kina this year in banks. For Papuans out there and media, cover this. Don't be lazy men sitting there dreaming for windfalls to fall down from the sky of politicians. Get up, organize yourself, go to the bank at low-cost borrowing. 200 million kina already transferred to the banks instead of transferring to Wantoks from Wulupendi House, as has been in the past. We've already put 50 million kina last year, and we're starting again this year on price subsidies, and we're trying to ensure this policy is teetered out on coffee, cocoa, copra, cacao, vanilla, oil palm, giving good price to our people in tough times, having money in their pockets. We're not just talking, we're exercising practical policies we feel can ensure our people get up and get better going into the future. We've ensured we put money in assisting parents. Of course, our government has been criticized for the TFF policy that we've shifted away a little bit, but we are paying school fee at 63% cost of school fee for children at elementary all the way to high school. And we've made intervention at tertiary school fees by putting the health program, so our parents are assisted in all sense, from elementary all the way to university. We also ensuring that we are paying off outstanding debts that government books have carried for a long, long time. Books that are directly under Treasury, debts, I beg your pardon, debts that are directly under Treasury, as well as debts that have been skillfully hidden away in other government SOEs. For the first time when we took office, we were transparent. We were honest. We brought all these books under one table. That related to us increasing our debt to GDP by almost 10%. We were not ashamed to admit this was national deficit and debt we were carrying. The result of being honest, Australia for the first time since 1975 gave us 1 billion kina to support retire 2019 money plan with 0% lending. New $300 million came into PNG. Contrary to past where there was no direct US dollar coming in, except the $300 million Swiss that we had to repay for only 12 months at over 8 and 9%. This one, 0% lending, 5-year grace period, start to repay in 2026 going forward, as I speak. Clear classical difference. Good borrowings that had least effect on the economy right away and give us the breathing space. Second, borrowing in a row to contrast capital. Japan, one of the hardest lenders in planet Earth because of the value on honesty. Japan is not Christians like Papua New Guinea, but they die for the word and honesty. They were able to lend 280 million kina right now in our banks, 280 million US dollar, I beg your pardon, at 0.01% lending, grace period 5 years. It started to be repaid at 2026. Mr. Speaker, hard times requires honesty, credibility, and hard work. At all levels, not only at Prime Minister or Treasurer level, at all levels. And I give you assurance as to this House, COVID-19 is here to stay. Our people, over 10,000, have been exposed to COVID-19. Some recovered, almost, and God forbid, but our number is hitting into 100. Almost 100 for those who have passed. We will remember them at this time. One life is important. I beg you, as we rise this afternoon, myself and the Treasurer of Finance and Planning will try our very best to assist in your district. Forget your ambition to be minister. Forget your ambition to be Prime Minister. That can come in 2022. That can come into the future. If stars is aligned for you or God's plan is for you, that is the moment, your moment in life. But today, in pursuit of something else, you might forego what you already have. The fundamental fact is that you're a member of parliament. Lest we forget, last term, over 5,000 people contest to be members of parliament, not ministers. Yet 111 won. You are the privileged few. In COVID-19 times, the demand is on us for us to rise collectively and not individually. If 89 districts respond in our COVID response, your investment in the DSIP goes to education, health, transport, housing, new ward. Our COVID help comes in. Provinces, go back to your governors. I ask you today, go back to your provinces. You sit down as head of your province, summon your PHAs. If a PHA doctor is not responding to you, summon him, summon your PPC, your administrator. 3 key persons. I instructed the National Control Center 2 weeks ago. I want 21 blueprint from our 21 provinces, including NCD, and our special region of Bougainville. If we can have 22 blueprints, ADB has indicated to me a possibility of a $2 billion facility available. We could unlock that into a clear plan that you provinces funnel to us, and not a Wagani-based plan that is being driven down to you, somewhat down to you. I ask this Honorable House, it's no ordinary time for us to stand around and Mickey Mouse and go in and out and try to worry about who's right or wrong. You know, we can live and dwell on the past, but it does no one any good. Let us collectively come together, hold hands, and step into the future. And that future, in my view, if we all work together, 22 provincial leaders, 89 district leaders, these COVID challenges can be overcome, because this government, your government, our government, stands ready to assist where we can. With this, Mr. Speaker, I retire my conversation.